Well, it will be among the first of its kind in this country. Quebec saying it is going to introduce a vaccine passport.
Put in place the passport in order that people who made the efforts to be vaccinated, that they are able to come back to a normal life.
And that was the Quebec Premier François Legault saying rising cases and fears of a rise in hospitalizations have made a vaccine passport necessary. He says the system will help stop widespread closures. Details have not been released, but the passport will be required to access non-essential services, and that includes things like restaurants, theaters, and concerts. Well, for more on this, we're now joined by Dr. Matthew Outen. He's an attending physician in the Division of Infectious Diseases at the Jewish General Hospital in Montreal, also an assistant professor at McGill University. He joins us right now in Montreal. Dr. Outen, good morning.
Good morning to you, Michael.
So let's begin with this idea of vaccine passports. Talk to us about the benefits of implementing this kind of regime that the Quebec Premier is talking about.
I think Quebec is basing this, at least in part, on what we saw happen in France, which was after the vaccine passport or their vaccine passport was announced. Then all of a sudden, a large group of people who were on the fence about whether they would go and get vaccinated decided to, and that really sort of pushed their numbers up. And this is, I think, the attempt to do the same thing over the month of August before the end of summer, the start of the school year, the start of colder weather. We're looking in Quebec right now, I think we're somewhere around 83, 84% that have had at least one shot. And I think the goal is to try to push those values even higher, because there's certainly reasonable estimates that if Quebec were to be hit by a major surge of Delta, that you're really needing something close to 90%.
Well, percentages aside and the effect of increasing vaccination rates, there's also this argument that he seems to be making that if there are vaccine passports, then such a thing as a widespread closure would not be necessary in the next wave. Talk to us about whether that's an actual reality here.
Certainly from the effect that even widespread vaccination would have on our population, I think that's a correct statement, in that if you have a population that's largely immune, it's not to say you won't have any cases, but you won't have the same large numbers all at once that led to overcrowding of our healthcare system, that led to classrooms and sometimes entire schools being shut down. So that keeps sort of these important institutions in our society much more stable, much more predictable, and I think that's certainly a good thing for everybody.
Now, of course, as you know, the counter-argument has to do with individual rights. Is there a potential of these kinds of passports infringing in any way on personal liberties?
It's a complicated topic. There certainly is that counterpoint. You could say that this system is an attempt to balance those individual rights of self-determination of choosing if people get the vaccine or not. But at the same time, you can't be free of the consequences sometimes of these individual choices. And that's where the collective rights, the rights of people to be able to live their lives and be as reasonably free of disease, preventable disease as possible. And this is an attempt, I think, to straddle that middle. Will it be successful? I mean, it certainly caused controversy in France, in other places. I think the idea of limiting it only for non-essential services, I think, was a very well-placed idea.
Mm-hmm. Now, there is still right now, outside of Quebec and certainly in the current regime within Quebec too, an emphasis on consensus building, this idea that education and accessibility could still be enough to convince the vast majority of Canadians to get inoculated. Will this passport essentially be an admission that focus just now doesn't work?
I think this reminds me of the old 80-20 rule, that 20% of the effort can yield 80% of the results, but to get that last 20% of the results, you need to put in a lot more effort. And I think as we get these numbers of the proportion of the population that are vaccinated higher and higher, the remaining group that haven't been vaccinated, there's a lot of different reasons. And I think you have to actually do multiple different approaches to address some of these different reasons. Vaccine passports will work for some people, whereas having the lottery idea, like Quebec has instituted, will work for others. Presumably, for some people, it's an accessibility issue. So there you have to work on how can I actually get the vaccine to the people or the people to the vaccine if they're having accessibility or transport problems. So it becomes more and more difficult, but it's certainly worthwhile. Because like I said, I think we really need to shoot for the high 80s, 90% marker. And at the present moment, unless we do things differently, I'm not sure that we would get there.
Dr. Matthew Outen, thank you for this. Appreciate the time.
My pleasure. Thank you.